and we'd more or less finished playing catch up, but we're still seeing problems coming in now that should have been spotted 6 months ago. So they're taking longer and they're more complicated than they should be. But now we're in the stage where we're sort of saying to people, we've got it on the Facebook page, we've put it out on sort of emails, and I'm saying on the radio, get in contact with your dentist. It doesn't have to be just us at Abbey. It could be anywhere, whoever your dentist is. Now is the time. If you think about a lot of people, we've got about 10 pages of patients that we haven't seen in over a year. And so that's a year they haven't had a checkup. And it's just a routine thing. And a lot of them, it'll be have a quick look and then out the door. But for a lot of others, there will be issues and there will be things that we need to spot. So, and just from an oral cancer sort of screening point of view, it's a good idea just to get your mouth checked sort of at least once a year, just from that point of view. You don't have to be a smoker. So the other thing we thought was, in the new year, Darcy was saying that people tend to come in and say, right, it's the new year, I want to join a gym, I want to lose weight, I want to quit alcohol, I want my teeth fixed. And so, again, if it's a patient that we haven't seen before, you got to remember that it's not just a case of improve someone's smile, improve the way the teeth look. You've got to sort of look at the mouth and the person in general as a whole, sort out or at least get a stable base to go from, and then you can do some of the more cosmetic things. So you don't want to paper over the cracks, and that sounds a bit daft, and we've seen a lot of cracks this year.
Yeah.
But we had a patient in this morning who had assumed everything was all right and wanted some gaps filling. And then, of course, once we actually kind of looked in there was quite a few bits that needed attention first. Nothing too serious. So it's nothing, people sometimes freak out and worry, well, I've had a bit of sensitivity, I'll leave that, and I'll leave that, and I'll leave that. And then when it gets really bad, then they come in. And a lot of the time, something that's quite small or something that you can't feel, get it when it's small, get it early, and then we can fix it before it turns into a big problem. But as what we thought in the new year, if somebody wants to say, right, well, I want to improve my smile, so, you can start off, you don't have to think big. You can start off with something simple like maybe just tooth whitening. That brightens everything up. You get a nice bright smile. Some of the teeth may not brighten, or there might be some fillings that need replacing. So then you might need to do a little bit of composite bonding. So composite bonding, we might need to take away an old filling and put a new filling on. Or there might be a few areas where there's a little chip or a little bit of shaping that needs to do. So we can literally just etch the surface of the tooth, rough up the surface of the tooth with the sort of acid etch that we use. Put glue on, and then we can put composite on. So it's quite minimal. It's
not very destructive, is it?
Yeah, we're trying to avoid. It's that kind of minimal invasive dentistry is what we're going for.
And all these procedures sound like there's an awful lot to them, and it's the sort of thing that essentially you can't do this by yourself, can you? Which is why Darcy's here. So you get massively involved with these, don't you?
We do, yeah. So a lot of my job is obviously setting up the surgeries, getting everything ready for Mark, but then the main part of my job as well is aspirating, so keeping the area clear so Mark can see, keeping the patient comfortable. Obviously you don't want them filling up with loads of water and stuff in the back of the mouth. I'm there to help pass Mark things, but then also sometimes if something is a bit unexpected, it's my job. If Mark's saying get me this, I have to be able to know where it is and to get that and assist that way. So
she'll think probably I'll be thinking 2 steps ahead at what I'm doing, but she's kind of thinking what she needs to do next and what I'm doing. So sometimes she's ahead of me, and other times, something might break and I'll turn for a piece of kit and I'm not actually, I know what I'm thinking I need to fix, but I'm kind of thinking just pass me the thingy and I'll point it.
He won't say the name. We're not
is.
thinking of the name, but I know what the thingy is somehow.
Yeah, because I'm reaching for something else, or I'm trying to stop. I'm trying to keep something dry. So she then has the aspirator, but she has to then put down what she's got and kind of juggle things. So we call it 4-handed dentistry, but to be honest, I mean, I'm quite happy with 2 hands. She's the one that could probably do with 4 hands, so she can pass me something wholesome.
Make my job more yeah, help me a lot.
Yeah. And then at the end, I could stop and just kind of, hands up, take my gloves off and say, right, I'm done, sit up, have a rinse, off you go, everything's great. And she's left with a mess to tidy up. So
So we are talking about nursing, aren't we, today? So that's an interesting question then from your point of view then as the dentist in the surgery. What do you think makes then an excellent nurse? Why is Darcy so brilliant, essentially?
Mark likes his surgery to be stocked up. The minute I say, oh my God, there's nothing there, then he's like, he's not very happy about that.
You see, I don't know whether the nurses over there could agree or disagree, but certainly dentists and surgeons tend to be we're quite anal about having the right equipment, and even if it's something you're not going to use, you like to have all your stuff set up. I mean, I don't know whether anyone's going to disagree with me there, or you know, do they like to have their things in their own little place? Or
you have to be ready for every eventuality, don't you? So
yeah.
So being prepared.
A nurse is prepared, and what you don't want is to sort of have to get something. I mean, this morning we put an implant in, and there was something that we were missing something. We did have a runner, so and I said, right, I need one of those, and Darcy goes, in that case, I'll have to just get.
Oh, it was the mouthwash, wasn't it?
Was that what it was?
Yeah.
Right. So we needed some extra mouthwash and some extra swabs, and I'd used up probably more than I should have done. So it was a case of, right, but we have a doorbell system, so you can sort of hit it with your elbow, because if you're scrubbed up and clean, you don't want to be touching things with your fingers. So usually Darcy will just elbow something, and that sets off a bell, and then someone comes running in to find out what's wrong, and they can run off and get it. But yeah, I mean, if she's prepared for everything, that's great, because everything's there. And I don't want. It's not that I'm impatient, but if I ask for something that I think I need, if she can pass it to me straight away, it's there. So it's like, there it is, and that everything seems to. You feel more. If it feels more efficient and it seems to flow more, then that helps my confidence. That helps my ability, and hopefully helps to reassure the patient, because we're normally dealing with obviously conscious patients who don't want to be in a dental chair. So the more we can make them feel at ease, the better. And if it looks like we're sort of juggling instruments and juggling things because we haven't got that. And sometimes you do run out of something. Someone's got to get it from the next surgery. But the smoother the day can go, the better.
Because some patients, they do just want to get in and out, don't they?
Yeah.
They don't want to be sat in the chair for an hour. So if it's there and you can get it and it runs smoothly, then
you can make the surgery as nice and as friendly as possible. They don't care. They want bum in the chair, open the mouth, get it looked at, get it done, and then out.
So if you're making a New Year's resolution then, as a patient of yours or someone thinking, I'll make a New Year's resolution for my teeth, should it be that you should actually go on the basis prevention is better than cure? Make sure you go. Funnily enough, I've just been for to see the hygienist and a checkup, and I go, I think, about 4 times a year. Yep. Is that good practice to get into, going regularly, even if there's nothing wrong?
Yeah, I mean, you want to assess. There's no hard and fast rule as to you have to go twice a year. You might find that some patients I'll see once a year. Some patients we might see, generally checkup wise, we'll go every 6 months. But if they come in with a problem, we'll still see them. So if we see them at, say, January, and then we see them 6 months later, if something breaks in the meantime, you're not doing a full checkup, you're not doing a full assessment. So you'll still say to them, right, I'll still see you in July, or I'll still see you in August, because I haven't checked everything else out. We've got other patients, some of the guys that are at uni, they might come in at sort of 10 months, and then instead of seeing them sort of 2 months later, so they've had 2 visits in 12 months, I might say, well, look, okay, I didn't see you for 10 months, but everything's okay, so let's see you next time you're back on the island. I mean, in normal times. But some patients we like to see every 6 months. Sometimes we'll see every 9, every 12. So there isn't a hard and fast rule. Hygiene-wise, you might find that you haven't got a single fill-in. So the dentist might say to you, right, well, I'll see you every 9 months or every 12 months. But you might have gum problems. So in that case, the dentist might want to assess you every sort of 6 months. Or he might say, look, I'm quite happy seeing you every 6 to 9 months, but I'd like my hygienist to assess you every 3 months to stay on top of that sort of thing. So again, you've got to remember, it's not a kind of cookbook approach. You don't just get a book out and go, right, patient A will see every 6 months, patient B will see every 9 months. You're trying to assess and look at the person as a whole. Someone without any teeth at all, so they've got full dentures, you might still want to see them every 12 months, every 18 months, just to check the dentures are all right, but they could be a heavy smoker. So you might think, well, if they're heavy smokers, should I see them a bit more often than every 12 months, just in case there's an oral cancer risk? So it's all those sorts of things. And again, a nurse can say to me there, I'll say, right, so I'll see you for your next checkup. And she might prompt me and go, well, when's that? So she's giving me a nudge and staying on top of me, so that it's oh yeah. Okay. So her job's just to make me look good.
Well, this is perfect chat to lead into what we're going to be talking about shortly with all the nurses that are in the corner as well. So thank you so much for bringing Darcy with you. Darcy, apparently you're the person that knows all the details for how people could get in touch with Abbey
yes,
Dental.
you have all the. Yeah, you can come every time from now on.
That's fine by me. So our telephone number, should anyone wish to get in touch with us that way, it's 823040. You can also send us an email, and that's abbeydental@manx.net. And we also have a Facebook page as well, and that's, I think, just type in Abbey Dental and we should come up.
Yeah, see, she's great.